It's 8:14 on the dot. A caregiver refers to anyone who provides care for another person. In fact, more than 20% of Americans provide unpaid care to a loved one. Vital care, but mindful, important to kind of remember the well-being of the caregiver too. Dr. Stephanie Sarrat from Primary Care Plus joins us with some thoughts on that. Good morning to you.
Good morning.
This is partly a function, obviously, of our aging society.
Absolutely. As the baby boomer generation ages, more and more people are falling into the caregiver and caregivee category.
So a lot of people find themselves, it's a parent or a spouse most often, I suppose.
Most commonly, it's a family member, sometimes a friend, sometimes even a community member that one feels a personal responsibility towards.
And obviously the responsibilities can vary both in terms of how much help you need and the kinds of help.
Absolutely. I mean, there's a broad range. It could be, getting the person up, getting them dressed, getting them fed. It could be tasks like managing finances. It could be transportation. It could be cleaning the house. But, it's any kind of unpaid assistance that a patient would need.
Excuse me, keeping track of those prescription pills, which
absolutely.
I've learned about the importance of those little pill boxes. They really do work.
The pill boxes help a lot, as does prompting. Managing medication is a big part of it, and communicating with medical practitioners as well.
How does this affect the caregivers, this responsibility?
Caregiving can be fairly stressful. It's a tremendous burden. It can be rough, but it also can be rewarding. But overall, caregivers feel more stressed than the general population.
Well, that's a good point, because we in the media sometimes will go to what the problem is. There's a saying that if the plane lands safely, it's not news. But I think it's important, too, to maybe recognize it can create a bond or deepen a bond, I assume, that wasn't there before?
Absolutely. Absolutely. A person can feel rewarded for spending that time taking care of their loved one, for just being there with them.
On the other side of the equation, though, is there a burnout factor? Somebody who's not used to doing this?
Absolutely. It can be. Caregiver burnout is a state of physical, mental, and emotional exhaustion that comes from this daily grind of caregiving. And the caregiver can feel anxious, depressed, withdrawn, fatigued.
So how do you fight that?
Well, it's important to take a break sometimes, and you shouldn't feel guilty about it either. Just take a break, do something you enjoy doing, ask a friend or a family member to take care of your loved one for a little while so that you could do something you want to do. You could also join a support group and find people, like-minded people who are going through the same thing.
And conversely, how do you help someone who's clearly, starting to feel the stress of this responsibility?
You could give them a break. You could just go over and volunteer to take care of their loved one for a little while so that they could do something. You could also just listen to what they have to say and show empathy and support for what they're going through.
It's a good point, too. Sometimes just voicing, what you're feeling can make a difference.
Just being there can be a tremendous difference.
All right. Well, Dr. Stephanie Sarrat from Primary Care Plus, we appreciate your time this morning.
Thank you.
An issue that many, many Americans are facing more and more.
Thank you.